I think a great philosophy towards treating patients is, if I can quote a fellow by the name of Dr. Leak, it's the Yo Momma philosophy. You treat every patient like she's Yo Momma. And if that philosophy is going to work, you have to like Yo Momma. But no, I think you treat every patient like they're a family member. And when I'm counseling patients, that's one of the things I'll always say, you know, if you were my mom or you were my brother, this is what I would recommend. And so I think you have to have that kind of philosophy. We don't stratify patients on, you know, what class you like best and what class you like, you know, not as much. And, you know, when I sit down with a patient, any knowledge on my part of what their coverage is or their insurance or, you know, what the reimbursement's going to be, that's just not even part of the thinking. I'm sitting there in front of another person who's entrusting me to, you know, bring my knowledge and skills to bear to give them the best outcome they can. And that's what I want. It's all about the best outcome. And I take a lot of pride in being somebody who's meticulous and compulsive in a manner that is designed to make sure that when I do a procedure, it's the right procedure done the right way to try to get the best outcome for that patient. Because what gives me a reward personally is knowing that somebody got better. These are not just spines that are coming up to talk to me. It's a person living with a spine and the problems that may come with that. And so I have a really comprehensive way of looking at that with the whole person, but also with a really comprehensive understanding of what all the treatment options are, not just the ones that I can provide. And I provide probably a broader spectrum than a lot of the guys that may be doing certain types of injections, certain types of procedures. North American Spine basically offered me an opportunity to expand the scope of what I offer beyond a lot that I was doing anyway. But by bringing the specific techniques and technology that they have to offer, that enhanced the niche, if you will, that I work in. But I found it really helpful to work with patients that have been thoroughly worked up, and these are patients who are seeking out, you know, care in a setting that for many of them they've gotten very, very frustrated because local physicians, you know, look at them and say, well, the only thing I can offer is a, you know, 3 or 4 level fusion for you, and or you really don't have anything, and I think I can help. And I think I've seen many patients that they've either been offered something much more invasive than what they want to undergo, or they've been told that there's nothing that can be done for them, or they don't really have a problem. You know, time and again I hear that because of the way I work closely with North American Spine's orthopedic spine surgeons. I can make sure that they get the best option if they have, you know, a more involved surgery that's going to be minimally invasive for them. So it's just been very, very rewarding to work with a company that has that kind of a philosophy that, you know, we're going to do the very best for you and offer you the best option